The prostate isn't exactly, cocktail party chatter. But hey, it's something that affects a lot of men. And frankly, the more we understand it, the better we can, take charge of our health, right?
Absolutely, and that's really what we're aiming for today, to really dig into BPH, benign prostatic hyperplasia. We'll break down what it is, how it's diagnosed, and the big one, what you can actually do about it. And for everyone listening, all of this is coming from a solid medical source, so we're not messing around here.
That's good to hear. So no, no dodgy internet theories.
Yeah.
You mentioned BPH, benign prostatic hyperplasia, but I think a lot of guys just think of it as, like an enlarged prostate. Is that accurate?
Yeah, pretty much. Basically,
Okay.
BPH is when the prostate gland, it gets bigger than it should be,
Hmm.
and while it's not cancer, it can definitely lead to some uncomfortable, even annoying symptoms.
Right, because we're not talking about some random gland here. This thing's connected to a pretty important system, the whole urinary tract.
You got it. Think of it this way. Imagine a walnut, right? Sitting right under your bladder, wrapped around the tube that carries urine out. That's your prostate. And as men age, that walnut, well, it can start to swell up, squeezing that tube and making it harder for the urine to flow out smoothly.
Okay, that makes sense. So this is pretty common as guys get older, yeah.
Incredibly common. Studies actually show that over half of men over 50 will have, to some degree, an enlarged prostate. And that number jumps to like 90% for men in their 80s.
Yeah.
But here's the thing. While age is a big factor, it's not as simple as saying, well, you're getting older. That's just what happens.
Oh. There's more to it.
There is. It's not just about how old you are. It's also about this mix of hormones, especially testosterone and one called DHT, dihydrotestosterone. These hormones, they, along with your genes, they really play a key role in how BPH develops.
So it's not just aging, it's like a whole hormonal shift going on behind the scenes. And what about this DHT? What does it do?
DHT, you can think of it like fertilizer for the prostate. It encourages cell growth, and unfortunately, that can lead to too much prostate tissue growing.
Interesting. So it's this whole hormonal, I guess, symphony that sets the stage for BPH. Does that mean we have no control over it?
Not necessarily.
Yeah.
See, we can't change our age or our genes, but research shows that lifestyle choices can actually play a big part in whether you develop BPH and how severe it is.
Okay, so even though we can't like reverse time, we might have some influence over how this whole BPH thing plays out. What kind of lifestyle choices are we talking about here?
Well, one of the big ones is keeping a healthy weight.
Mhm.
Studies have linked obesity to a higher risk of BPH. And it's not just about preventing it. Extra weight can also worsen symptoms you already have.
So those extra pounds can put extra pressure on the prostate, literally.
Exactly. And then there's what you eat. Remember that saying, you are what you eat? Well, turns out it might apply to your prostate too.
Okay, so what should guys be eating to, I guess, keep their prostates happy?
Some really interesting research suggests that a Mediterranean diet, lots of fruits, veggies, healthy fats, that could be beneficial. There was a study in 2021 published in the journal Nutrients, and it found that men who ate a Mediterranean-style diet, they had a much lower risk of BPH.
Wow, so what you choose to eat can actually make a difference.
It can. And it's not just what you eat, it's also about things you might want to cut back on. Too much alcohol, caffeine, those can irritate your bladder and potentially make BPH symptoms worse.
Okay, starting to see a pattern here. Taking care of your overall health seems to be good for your prostate health too.
You got it. But even if you're the picture of health, sometimes BPH still develops. So let's talk about recognizing the signs.
Okay, symptom decoder time. Let's say someone's thinking, maybe I have BPH. What should they be looking out for?
Well, a lot of it comes down to changes in how you pee. Remember that walnut squeezing the flow? It's going to affect your bathroom habits.
Yeah, it's all connected to the plumbing down there.
Exactly. One of the most common signs is having to pee more often, especially at night. Ever gotten up a bunch of times to go, but you can only squeeze out a little bit?
Oh yeah, I've heard a few friends complain about that.
Well, that's classic BPH.
Yeah.
And then there's that sudden urge to go. You can't help it.
Okay, so frequency and urgency, those are red flags. What else?
Another one is a weak urine stream.
Yeah.
Think about trying to water your garden with a hose that's all kinked up. It's not going to flow with much force.
And that's because the prostate is basically constricting the urethra, right? Makes sense.
Exactly. And here's another fun one. Dribbling. That feeling of not being able to completely empty your bladder, like
Yeah.
it's holding back a few drops just to mess with you.
Ugh, sounds frustrating. So these are all signs that something might be up with the prostate, but are there more serious consequences of BPH that we should be aware of?
There are. BPH itself isn't life-threatening, but if you ignore it, it can cause some serious complications. For instance, that constant strain on your bladder can increase your risk of UTIs, bladder stones, even damage to your kidneys.
Okay, so definitely not something to brush off. So let's say someone's having these symptoms. What's next? How is BPH diagnosed?
It starts with a visit to the doctor, and I won't lie, you're probably going to hear those words, digital rectal exam.
Ah, yes, the infamous DRE. Not exactly a fun topic, but why is that
I know,
necessary?
I know it's not the most comfortable thing, but it's really important for diagnosing BPH. Remember that walnut analogy? The prostate is right in front of the rectum. So DRE lets the doctor actually feel the prostate, its size, its shape, and check for any weirdness.
So it's all about location, 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 but is that enough for a diagnosis?
Not quite. The DRE is just the start. The doctor will probably order a urine analysis to make sure there's no infection, and a blood test to check your PSA levels. That stands for prostate-specific antigen.
Okay, PSA levels. I've heard that before. Remind me, what is that exactly?
PSA is a protein made by the prostate. And if the levels in your blood are high, it can sometimes mean you have BPH. But it's
Yeah.
important to remember, PSA can also be high because of other things, including prostate cancer.
So it's not a surefire test for BPH, but it helps eliminate other possibilities.
Yeah, exactly. It's like a clue for the doctor. And depending on your situation, your doctor might also recommend imaging, like an ultrasound.
What would an ultrasound show that the other tests wouldn't?
An ultrasound, it gives a picture of your prostate and bladder so the doctor can see the prostate's size and shape, spot any blockages, and basically get a better idea of what's going on.
So they're really getting a clear look inside. Why is all of this so important? Why not just, assume it's BPH and go straight to treatment?
That's a good point, and it shows why getting the diagnosis right is key. First of all, we have to make sure it's not something else causing the symptoms, like
Yeah.
prostate cancer. And second, understanding the details of your BPH, how big your prostate is, how bad the blockage is, all those factors, it helps the doctor make a treatment plan it's right for you.
Okay, that makes sense. So once BPH is confirmed, what are the options? What can be done about it?
The good news is there's a bunch of treatment options, and the best one for you, it depends on a few things: how bad your symptoms are, your overall health, what you prefer.
So it's not a one-size-fits-all approach.
Not at all. And this is where things get really interesting.
I'm really interested to hear about these different BPH treatment options. Where do we even begin?
You know, it might surprise you, but sometimes the simplest place to start is with some lifestyle changes.
Really, just changing your habits can make a difference with BPH.
Absolutely. Remember we talked about obesity being a risk factor.
Right.
Well, even losing a little bit of weight can help improve those BPH symptoms.
So it's not just like good for your overall health. It can directly impact how bad those symptoms are.
Exactly. And then there's the whole diet thing. Remember that Mediterranean diet we mentioned? Good for your heart, and it turns out it could be good for your prostate too.
Yeah, that study was pretty convincing, but aside from diet and exercise, is there anything else people can do like in their everyday lives that can make a difference?
There are. One easy thing is being smart about how much you drink, especially close to bedtime. Cutting back on fluids in the evening can help reduce those nighttime bathroom trips.
Okay, that's pretty simple. Avoid that late night glass of water. Anything else?
Another thing to watch out for is bladder irritants. Things like caffeine and alcohol. You don't necessarily have to cut them out completely, but reducing them can sometimes help ease symptoms.
So it's about paying attention to how your body reacts to things and adjusting accordingly. That makes sense. But what if those lifestyle changes aren't enough? What's the next step?
Then we start looking at medications. There are two main types of drugs that doctors often prescribe for BPH.
Okay, let's break those down. What's the first one?
The first type is called alpha blockers. What these do is they relax the muscles in the prostate and the bladder neck. Basically, they ease the pressure on that urine flow.
So they're kind of like muscle relaxers, but specifically for the prostate.
That's a good way to think about it. And the good thing about alpha blockers is they tend to work pretty fast. You'll often feel relief within a few days, maybe a few weeks.
That's great. Are there any downsides to these medications?
Like any medication, alpha blockers can have side effects, but they're usually not too bad. Some men might feel dizzy, get a headache, or just feel tired.
Okay, so it's about weighing the benefits against those potential side effects.
Hmm.
What about the other type of medication for BPH?
The other type is called 5-alpha reductase inhibitors. Now, these work a little differently. Remember DHT, that hormone we talked about, the one that makes the prostate grow?
Yeah, the prostate fertilizer.
Right. Well, 5-alpha reductase inhibitors, they stop your body from making DHT. Essentially, they cut off the fuel supply to the prostate.
So they're not just relaxing muscles, they're actually trying to shrink the prostate.
That's the goal. And they might take a little longer to work than alpha blockers, usually several months, but they can be very effective at shrinking the prostate and improving symptoms over the long term.
Interesting. So two different approaches, two different ways of working. So does that mean a doctor might prescribe both types of medication at the same time?
Sometimes, yes. Combining both alpha blockers and 5-alpha reductase inhibitors, it can be a really effective strategy for managing BPH, especially for men who have, more severe symptoms.
Makes sense. Hit it from both angles. But what if lifestyle changes and medications just aren't, providing enough relief? Are there other options before we jump to surgery?
Absolutely. There's a whole world of what we call minimally invasive procedures that have become really good alternatives to traditional surgery for BPH.
Okay, tell me more about these minimally invasive procedures. They sound promising.
One that's pretty common is called transurethral microwave thermotherapy, TUMT for short. It uses microwave energy to heat up and destroy extra prostate tissue.
So it's like a targeted heat treatment for the prostate.
That's a good way to put it. And here's why it's minimally invasive. The procedure is done through the urethra, the same pathway urine uses to leave the body. So no cuts, less pain, and a faster recovery compared to traditional surgery.
Got it. Are there any risks or side effects that come with TUMT?
There are some potential side effects, just like with any medical procedure. Some men have trouble peeing for a bit after the procedure, and there's a slight risk of bleeding or infection. But overall, it's generally considered a safe and effective treatment for a lot of men with BPH.
That's good to know. What are some other minimally invasive options?
Another one that's pretty cool is the UroLift system. Imagine tiny little spring-loaded implants that lift and hold the enlarged prostate tissue away from the urethra.
So instead of destroying the tissue with heat, it's more about making space for the urine to flow freely.
Exactly. It's like propping open a doorway that's been blocked. And because the UroLift doesn't involve cutting or removing any prostate tissue, there's a very low risk of side effects, especially sexual side effects, which can be a worry with some other BPH treatments.
That sounds like a real game changer for guys who are concerned about those side effects. Are there any other minimally invasive techniques that are worth talking about?
There's also transurethral needle ablation, TUNA, that one uses radiofrequency energy to heat up and shrink the prostate tissue. It's kind of like TMT, but instead of microwaves, it uses radio waves. And then there's laser therapy, which uses a laser to either vaporize or remove extra prostate tissue.
Wow, so many different options. It seems like there's been a ton of innovation in this field.
There has, and
Wow.
it's important to keep in mind the best option for you will depend on a few things like how bad your symptoms are, your overall health, and what you're comfortable with.
So it's not just about choosing the newest, coolest technology. It's about finding what's right for your specific situation.
Exactly. And that's why talking to your doctor is so important. They can help you figure out the best course of action for you.
Makes sense. But with all this talk about minimally invasive procedures, it makes me wonder, when is surgery actually necessary for BPH?
That's a great question. While minimally invasive procedures are often the first choice, there are some situations where traditional surgery might be the best way to go.
Okay, like what? When would it make sense to choose surgery?
Well, if other treatments haven't been successful, or if the enlarged prostate is causing some serious problems, like repeated urinary tract infections, bladder stones, or kidney issues, surgery might be the best way to really take care of the problem.
So it's kind of like the last resort, but sometimes it's the most effective solution. What type of surgery are we talking about here?
The most common surgery for BPH is called transurethral resection of the prostate, TURP.
TRRP, yeah, I've heard that term. What does it actually involve?
It involves putting a special instrument through the urethra to remove that excess prostate tissue. It's a bit more invasive than the minimally invasive stuff we talked about, but it's still considered pretty safe and effective.
So it's still going through the urethra, which means no big incisions, but it's more involved than something like urolift.
Exactly. And there are other surgical techniques that use lasers to vaporize or remove prostate tissue. Which technique is used, it really depends on your individual case.
Wow, so many ways to treat BPH. It's really good to know there are so many options out there.
It is. And with all these options, there's a good chance you can find a solution that works for you and lets you live a full active life, even with BPH.